Welcome to The Pulse, the official podcast of the Georgia State Medical Association.
Well, hello again. Welcome back to The Pulse, and I am Dr. Julianne Adams-Burt, your host once again. Thank you for joining me, and thank you, Dr. Adrienne Sneed. I am so happy to have Dr. Sneed with us this evening. Let me tell you a little bit about her so you will know why she is the woman for tonight's talk. Dr. Adrienne Sneed is a native of Atlanta, Georgia. She graduated from none other than the Westminster Schools. Dr. Sneed, I am so honored to know this fabulous woman. She went to Chicago to get her Bachelor of Science in Biomedical and Chemical Engineering from none other than Northwestern University School of Engineering. She is a bad mamma jamma. Her time in research and development for Eli Lilly, designing cardiac pacemakers, led her to have an interest beyond cardiac medicine. Even though she was interested, she found a love and wanted to treat lower extremities. And this is all coming full circle for Dr. Sneed. She was doing research and development with prosthetic limbs. Dr. Sneed used her engineering roots to pursue surgery. She then went to Temple University and did her residency in Buffalo, New York. She is board certified in medicine, surgery, and wound care. Subsequently, she followed her interest in, remember, cardiovascular health, and became one of the first podiatric physicians with Northside Vascular Institute. She has numerous certifications and numerous awards. I am so happy to say that she was the first podiatrist in the over 130-year history of the Atlanta Medical Association. Okay, she was the first and only podiatrist to be the president of the Atlanta Medical Association in 2018. She has received awards given not only by the Atlanta Medical Association, but the Georgia State Medical Association, and so on and so forth. Y'all, there's just so much about Dr. Sneed. I need you to understand how not just qualified she is, but she is verifiable. She's smart. And tonight's discussion, you are going to see why. And it is such an important conversation that she herself helped to curate, not just on a local level, but on a national level. So I want you to help me and welcome Dr. Adrienne Sneed.
Thank you, Dr. Burt. It's wonderful to be here. I look forward to it.
Awesome. So I'm going to say just how I've said it before. I am a gynecologist. I am a women's health specialist. So tonight's conversation is a lot that I don't know. So I'm not going to throw anything hard at you, because we as the people, we in the community who see not only our patients, but our loved ones who are impacted by amputations, we want to hear and learn from you. So first of all, I kind of shared a little bit in your bio, of course, but what inspired you to focus on the prevention of amputations among people in our communities who suffer with diabetes?
So it started again with the actually working with prosthetic devices. And so as I was designing those prosthetic devices and fitting them for patients, I discovered that those patients had amputations for no reason at all. It could have been something as small as an ingrown toenail or stepping on a tack. And these were young people. It was no reason for them to have an amputation. And it was happening over and over again. It wasn't just one time. So that is what started my passion, that we have to stop. Even though I could have stayed in the prosthetic division, it was better to just save someone's natural leg.
Wow, that's huge. So how big of a problem is it for diabetic related amputations in the US today?
So if a diabetic, even if, say, for some reason they have an injury, a wound, something small, if they go into an emergency room and they say, oh, it looks dark, and we think just the tip of the toe needs to be amputated and you can go home in a day or two. Within 5 years, 90% of those will be deceased. That is in our community. That is how serious it is.
So would you say that there are certain populations or maybe regions of our country that are more affected by this?
Absolutely. So it's more so people of color, unfortunately, and it is definitely in areas where you see a larger population of people of color. So the South, the Southeast, the Texas, Mississippi, those areas are hit the hardest.
Wow. So, okay. So give us some help. So either we help ourselves or our loved ones. What should people be looking out for? When you talk about diabetes as the reason, is that right? Diabetes is it the number one reason for amputations? And if so, could you give us a few other causes?
So it is amongst the number one. I would say between diabetes and having actually peripheral arterial disease, so PAD. So the combination of the two is the dangerous part of this. So you need to have a diabetic that is well controlled. So the first thing to do to prevent any of this is to definitely make sure that your diabetic patient is well controlled. If they are not, send them to an endocrinologist. Make sure we get those blood sugars within range because they're at higher risk for infection and amputation if it's untreated or not treated as well. Then when you're talking about patients that don't have diabetes, but maybe they have a history of strokes or they have a history of dark legs, you need to make sure that they are getting an exam for their arterial flow to make sure they have good flow. So even when someone has an infection, say if they have a wound, they have an infection, whether they're diabetic or not, you can't get antibiotics to that area if there's no flow there. You can give them through IV, oral, it does not matter. It's not going to get there if there's no flow. And so that is the number one treatment, is to get that flow back.
Right. So okay. So tell me this. Just go through. Well, first I want to know: are diabetics more prone to being the ones diagnosed with PAD? Do they go hand in hand? Is that common? And then, if you could just share with us risk factors that we should be, um, looking at and sharing with our loved ones who are, I guess, who are diabetic, or we may have noticed their leg. We may have noticed the discoloration. What are the risk factors?
So it's not just diabetes. Definitely that's number one. But also if your loved one has a higher level of cholesterol, you need to watch the cholesterol because that causes blockages in the artery. You need to make sure you need to check on their hypertension. If their hypertension isn't controlled, you have to make sure that that is controlled. Age is a factor. So if you're over 65, age is definitely a factor. If you're immobile, if you're not getting exercise and walking, that is a factor. So it is not just one thing that you can fix. It is all overall health. So all the things that we've learned all over the years about eating healthy, exercising, and having knowing your numbers, doing your check, that is important. And all of it goes hand in hand. So it's not just one fix. You definitely have to do all of it, especially if you're diabetic, because you're at a higher risk.
Got you. So is there like, years of the diagnosis that make people more at risk? I heard you mention 65 and older, but is it, someone with a hemoglobin A1C, which is a level that many of us follow to kind of tell us how well or poorly controlled a diabetic is? Is that a thing? Like, I don't know. I guess because as a gynecologist, I do offer A1C, but I don't do everything else. I do look at my patient's legs, and so already undressed from the waist down. And I have said, have you seen a vascular surgeon lately? And oftentimes they have not. But is there some kind of correlation even with A1C values?
So definitely. So the higher the A1C level is, then the more at risk you are for infection. That means that diabetes is uncontrolled. You're going to have a higher cardiovascular risk if that A1C is uncontrolled. We really want to see if you're diabetic, that means that your A1C is going to be 6.5 and over. But we have patients out there with the A1C that are 15 and 16, believe it or not. And
Mercy.
so they're at the highest risk. Just yesterday, one came in, a new patient walking in, and their A1C was over 13, and they had MRSA. So you're at risk for some of the more dangerous infections as
Can
a
you
diabetic.
explain MRSA for
MRSA is methicillin-resistant Staph aureus. So we call those the superbugs, the super infections. So that means that when you get a basic bacterial infection, most of our antibiotics can treat them. But then there's a select few bacterium that do not respond to antibiotics or don't respond well. And those are our super infections. And so those people are highest at risk. Sometimes they don't recover. And just more recently, in the past 10 years, have we come up with some of the new medications. And there's only like 3 or 4 that can treat this. Otherwise, there's not much recovery.
So here in the state of Georgia, I'm going to just assume that one of the biggest barriers is not just insurance, but access to care. I don't know what it's like in Middle Georgia or South Georgia, but for specialists who can even speak to these things. So I do worry as we're having this conversation that some folks are, they may shrug off what we're saying because they may not be able to get to a big city and come find you as a podiatrist or other vascular care. But I wanted you to just speak to the social determinants of health and how that impacts the increased risk of someone ending up with an amputated limb.
So obviously not having, as we lose our hospitals across our state, especially, then there's obviously less access to health. But I'll be honest with you, even if you do get to a hospital, that not everyone is a limb preservation specialist.
Right.
Be honest, not every doctor knows. And so that is what's important about getting our message out there. It's not just to the public, it's even to our own colleagues. If you don't know, then send them to someone who does know. What we don't do is amputate first. Unless someone is septic, if you know that they are, that is life-threatening at that moment, then you've got time. And I hate to say it, there's such a thing as auto amputation. The body will take care of it itself. So you have time.
Oh my! Did you just say auto?
Yes,
amputation.
I did.
So as long as the patient's not,
the problem is solved. So
as long as the patient's not septic, so
Yes.
they're not fevers and their blood pressure is not dropping,
Right.
and they are with us. If I take my loved one to an emergency room, and the person they're caring for me mentions you need that amputated, how do I know as a community person that I have time?
So that's what we want to do. We want to empower the patient. So my first message and the last message is that do not always get a second opinion and don't make a rush decision about this. Because the amputation, once you get even a tip of a toe, then it starts a cycle of things that could be very devastating. So give yourself time to think about it. What you want to do, one of the things we have is the ARC Act. And so that's the Amputation Reduction Act. So the Amputation Reduction and Compassion Act, so ARC. And so one of the things is that we are trying to mandate that there's vascular testing. So most of these patients that go into an emergency room or even scheduled for surgery, they have never been tested for their circulation. So they didn't even know that it could be revascularized.
Wow.
It's an outpatient procedure. It's something that just takes an hour. And you get that flow back The antibiotics can get to the toe, to the foot, and there's no amputation needed. It heals normally. It might take a few weeks. It's not, it's not something we're trying to rush to do,
Right.
but most people never ever have that test. So that is what the ARC Act is all about, which is something that is not only in the state of Georgia, but nationwide and international,
Mhm.
to make sure that that there is testing before amputation,
Wow.
which means to mandate that.
So that is available here in the state of Georgia.
Yes,
That's
it
a
only
okay.
takes less than 2 minutes.
Oh wow. So let me tell you, audience members, just this past summer, Dr. Sneed presented this information to other physicians, her colleagues, and the pictures. We're not going to rush you out. I don't know if when you're watching this lunchtime, dinner, we're not going to rush you out. But she shared with us, again, I'm just a women's health specialist. I was clutching my pearls. And she asked us, she would throw pictures up there and say, what do y'all think happened with this person? And there were a few of them. I was like, well, if he wanted to walk, at least wheel out of there alive, he had to get that leg cut off. And then she showed us pictures after flow was restored. So I'm sharing that with you so you can understand this is not a myth that we're talking about. These are real life patients and real life doctors who have the expertise. You just need to delay a little bit and give yourself and your loved one time to go and see the specialist. So a vascular surgeon, you would say, like, who's capable of doing that test? Is an internist, internal medicine doctor, or do they
Anyone
need to
can do
see
the
a
test.
specialist?
So these tests is called an ABI test. It's called an ankle brachial index test. And
Okay.
so what it's comparing is the flow in your upper extremity to that of your lower extremity. So imagine a blood pressure. So if it's 160 in the upper extremity and it's 160 in the lower extremity, we don't want it that high. But
Right. Okay.
that's a ratio of 1-to-1, and 1.0 is perfect flow. But if
Mhm.
there's a reduction, if you say 160 in upper and you have 100 in the lower extremity, well, that's not a good number. And so that shows there's a reduction of flow to the lower extremities, and there is obviously blockage. From there, we go to an arteriogram. So we know now so that first test, the ABI, is 2 minutes. Then we know, okay, there's a reduction in flow. So then we're going to do an arteriogram, and that's ordered in the hospital usually. And from there, we'll know exactly where the blockage is, how great the blockage is, which vessels. And then that is when it goes to a cardiovascular surgeon or vascular surgeon. So cardiology and vascular can do both of these procedures. And then they can actually restore flow. And the patients during this procedure, they are awake. They have what we call moderate sedation. So the patient can speak with you. They know what's going on. And as soon, it's like a roto-rooter. So if you imagine your kitchen
Mhm.
sink being actually clogged, it
Okay.
actually spins around and it clears it out, and you see it on the screen. And immediately you see the flow go through, and you're watching this restored. The
Wow.
patients usually describe it. They say, uh-oh, doc, I think I just urinated on myself. The reason they feel that way is because they feel the warmth of the blood going down their legs. And that's
Mm.
the feeling that they get. And so then, success. Yes,
Mm.
it's been restored. So, but they're awake and they're able to tell you.
That's awesome. That is awesome. So I'm going to share this next thing. I'm going to tell you, I got permission to share this story, but one of my line sisters actually um, was admitted to the hospital, but unbeknownst to her, she was being admitted and was in the ICU. I believe her blood sugar was well over 800.
Oh, wow.
I think she recently told me her A1C in that moment was over 11. And so the doctor came in ICU, and she was going to be transferred to a regular floor at this point. She was stable, but she says, "Oh, I like your toe color. I like your toe polish." And she goes, "Oh, thank you." She goes, "We'll cut every last one of them off." It
Oh, wow.
scared her. I mean, that sounds bad, but she was trying to achieve the outcome that she did, because praise God, my girlfriend is off all meds. Her
That's
A1C is under 5.7, which we consider the start of
yes.
pre-diabetes. She is controlled. It scared her straight. I don't know if the doctor would really refer her for amputation,
Right.
but I thought how empowering in a crazy way it was. So I think about her, and I just want to go back to, because she and I talk often. She is so dedicated. I think she'll kill me if I don't remember the details, but I think it's been 8 years since that day. And what are the most effective? You mentioned, I think you said something about routine care, but please share with our audience who should they be seeing? How often? Is it a podiatrist that they need to see? Is it good enough that they say, oh, I got an internist or I got a family doctor? Just speak to that and what the regular exams need to look like.
So a diabetic definitely needs to be seen every 3 months by someone. They should
Okay.
be seen
Like
by a
podiatrist.
podiatrist every 3 months, but definitely their primary physician also.
Okay.
But if you're not diabetic, you still need regular care. You still need to see your physician every 3 to 6 months or 1 year if you're stable. But when you go to your exam, you need to take your socks and shoes off. No matter what doctor is seeing you, take your
Good.
socks and shoes off because they hide a lot of things. Had a patient come in yesterday, just saw his primary 2 weeks ago, and just walked in the office yesterday and took off a sock, and I'm looking at bone. I'm like, well, why didn't you? I said, what is your primary doing? Are you on antibiotics? He said, well, I didn't tell my primary. And I never took off my shoes and socks. Well,
Wow.
why not? It's been here a month. Well, my wife was taking care of it. So that patient is currently in the hospital. So,
Good job. Mm-hmm.
So, but those are the kind of things to make sure that they are going on a regular basis and taking their socks and shoes off. Even if they don't think it's important, we are trained, no matter what field of medicine you're in, we are trained to know that this is an emergency.
Mm-hmm.
So
Mm-hmm.
as an OBGYN, if you saw the bone, you would say, this is an emergency.
Yeah.
No matter what field of medicine you're in, it's important to do that.
What would you say to our female patients about going and getting, I'll put it this way, you may speak differently to it, the uncontrolled diabetic who wants to every 2 weeks go and get her pedicure? Is there any advice that you would like to share about that?
Yes. So there are great places to get pedicures and there are not so great places. But if you're diabetic, the only thing you should be getting there is polish. There should not be any cutting whatsoever. Cutting the cuticle, definitely not. Cuticle is there to protect us from bacteria and anything else. So when you start cutting around the toenails, the cuticle, that's allowing bacteria to enter, and that's a bad thing. Digging up under the toenails, again, bad idea because you're going to cause minor injuries that you may not even notice till later on. And then I'm not sure exactly when someone introduced a kitchen appliance into the nail shop. Why are they using cheese graters on people's heels? I don't know. So
like, what?
Everything that stays in the kitchen stays in the kitchen. Do not bring it to the nail shop.
Right.
So, but for a diabetic, do not let anyone ever cut. If you want the massage, the soak, and the polish, that is fine.
Okay.
That is where it stops. And for other people who are not diabetic, still be careful because you can still get an infection,
Right.
and and if you do, you need to still definitely seek help from your physician because you might need oral antibiotics and not just a topical like a Neosporin.
Yeah, that's good. And I will just kind of a plug, but I don't have her information. My mother, 86 years young, ever since the pandemic, we actually have her nail technician was so proud to let us know that she went and got certification, and she has some sort of specialty certification to handle her clients who also, have some issues, and the elderly. So she's very careful, and whatever the certification is, you may know what I'm talking about. She is able to care for those kind of patients or our patients and her clients. So I would say, even if you do go in and say, I'm not going to get all this extra stuff done, because I'm not diabetic, and I go ouch at least once or twice
Oh,
when I go to see, my nail technician. I'm like, that was a little close. So I
no,
think it's important for us to do the
change,
research. Yeah,
change.
change. All right.
It should never hurt.
All righty. So I would like to shift a little bit and have you address, I don't know if that was the art that you spoke of, but the movement that you, along with the other podiatrists and cardiologists, and I guess all those folks who take care,
Mhm.
could you just share with us what the movement has been and the successes and what the goals are legislative wise? Share that with us because we're proud of all of that.
So this one is from the cardiologist who actually got this through in Illinois. It's called SB 1418, and so it addresses this entire arc that we're talking about. And so it did pass, thankfully, this year, 2025. So it passed both sides passed in Illinois. So that means beginning in January of 2027. That there will be mandates before there's amputations. So when you're in the emergency room or wherever you are, there's going to be mandatory testing for a vascular testing before there could ever be an amputation. And so we're hoping, because they opened the floor for this, I've already started, I've drafted it for the state of Georgia. Hopefully it will go to the floor in 2026. We're praying for it. But now that one state has it through, it's a lot easier for it to go through other states. And hopefully our Black Caucus is going to pick this up and take it to every state and territories.
Well, I, for one, support that wholeheartedly. And when we get off of this, we're going to have to talk about what next moves need to happen, because January will be here before we know it. And hopefully we can, start making the noise that we need to make for our loved ones. So as a podiatrist, I would like for you to share a little more about patient education. What are the top 3 things that you tell your patients in order to protect their feet and legs?
So protect them from amputation,
Just
correct?
protect from infection.
One, don't walk barefoot. Do not walk barefoot unless you're on the beach. Do not walk barefoot.
Wow.
Even if you're in the house and you step on glass, I pull all kinds of objects out of people's feet, even when they're walking at home.
Really?
Bedroom shoes or something.
What's the worst thing you pulled out? Go on, tell it.
So, oh gosh, it was bad. It was actually a light bulb. So it was one of the light bulbs. Just when they break, they don't break in 2 or 3 pieces. This one was crushed. He had hundreds of pieces. It took me hours to pull every little piece of the light bulb. And since they're translucent, if it was green glass, I could easily find it. But you're just picking and just trying to find something there. So that's one of the worst. But I've seen all kinds of sewing needles. There's one, actually, I just found the other day. She didn't know why the swelling was there. She actually has a BB. Somebody shot a BB and she didn't know it, and it is lodged in her foot. So now she's getting her CT scan so we can try and get that out. But there's all kinds of things in there. You name it. And some of them can be removed, some of them can't. Even bullets. So guy was shot with a bullet that shattered within the foot. So not only did it shatter the bones, but the bullet shattered in the foot. So you can only get out some of the larger pieces that would actually obstruct blood flow. The rest, it was better for it to just stay.
Okay. So no more walking barefoot. Got it.
That's number 1. Number 2, make sure your feet are clean. I hate to say it. Keep them clean, because those infections, if you get a little scrape or something and they're not clean, it's going to become a bacterial infection or a fungal infection. So keep them clean. And the next one, do not wear shoes that are improper, because if you wear a pair of shoes just because they're cute and they're too small or they're too high, and you cause other injuries to your foot, whether it's a callus that becomes a blister, that becomes a wound, wear shoes that properly fit. and are comfortable. You don't break in your shoes. Your shoes should be comfortable from the beginning. So
So,
it's not you breaking in the shoes are breaking you in. So,
so what does too high mean?
so if you're wearing 6-inch heels, I will see you one day.
Ooh, all right, now y'all heard it. Y'all heard it from Dr.
You can't
Sneed.
wear 6-inch heels all day, every day. And those who can, God bless you, but yeah, you will come to see me one day.
One day. Is
One day.
there an age that you recommend, especially the women patients who like to wear their heels to church and stuff? Is there an age to where you start to recommend that they come down or get a wider base, stop trying to wear the stiletto?
No, it's not an age. It's only if you're a risk for falls. So if
Gotcha.
you are a patient that is not as stable, and because of your aging, if you're a patient that maybe has had a stroke and not as stable, you know,
Mm-hmm.
anything like that. If you're using a cane, don't put on your 6-inch heels and use your cane and you walk.
Right.
That's not, no. So
Even a
most
walker?
right. So I'm like, the patients who are a fall risk, those are the ones that need to start lowering that heel height for sure.
Right.
So, but no, if you can wear your shoes comfortably, they're not causing you any problems, and you're trying to look cute, I say, I'll go for it.
I wish I could show you my shoes right now. I won't. I'll spare you. But I wear wedges. I love a wedge heel.
Mm-hmm.
And people look at my heels and I'm like, I don't always wear a little, I need to
Nope.
be able to move and I don't want to be embarrassed and fall down. So that's funny. I got thinking
And for
about
the
something.
shoes, just to go on. So when you wear very high heel shoes, you're putting pressure points on your foot. So the pressure points are going to be in the ball of your foot and in
Right.
the heel too, whether if you have a spike shoe. And so when you put those pressure points on your foot, then you actually can cause not only wounds, but you actually advance having hammer toes and bunions and
Mm-hmm.
those types of conditions, which
Mm-hmm.
lead to arthritis, which lead to chronic pain. And you don't want that.
And you know what? Amongst girlfriends, we talk about how, that's why the shoe bag has become like a popular thing. If
Yes.
you going to an event at someone's house, you walk in either with your sneakers or your flats. And if you're seated and you just want to cross your legs and be cute, that's one thing. But if you got to stand up, that's a total different story. So we've learned to be cute and have a cute little shoe bag too, just for the optics.
Your
Anywho,
shoes should have a time limit. So I have my 1-hour shoes,
wow.
my
I
2-hour
like it.
shoes,
Uh-huh.
my 8-hour shoes. So, and you make sure that you take the 8-hour shoes with the 1-hour shoes.
Wow. Okay, so we're about to wrap up. I want to, because you started speaking about the work that has been done successfully in Illinois and what you are hoping to bring here. Can you maybe offer a way for our viewers to get a part of the advocacy, to get on that train? What can people do in their communities or with their legislators? Anything?
So yes, you need to speak with your senators, because the way we were introduced to this in Georgia politically, that actually one of our senators lost a spouse due to an amputation, just the tip of the toe that actually was amputated, then the leg, then the other leg, and within 5 years,
Mm,
that spouse was deceased. And so that is the reason that they got on board. So, but
hmm
speak to your other political leaders. Hopefully, they will know about this. Hopefully, they already know, but they definitely will know next year. And tell them how badly we need this. We're trying to protect our community. So one of the things you need to think about, we're not just talking about loss of a leg. So if you have someone who is the breadwinner in your home and they lose their leg, now what happens? So you lose your home, you lose your car. Now your family structure has broken down. Now one person's taking care of another. So maybe it's the loss of 2 jobs. And now
hmm
it goes to the children, and then the grandchildren are burdened. So it is not just that one patient, it impacts the entire family. And if
hmm
that person was someone who contributed to the community, now it impacts the entire community. So we're not talking about just someone living through this on their own. And we're talking about the depression that goes along with this. There's so much that goes along, and it costs us billions of dollars a year. It
hmm
is cheaper to actually treat these patients than to amputate them and lose their income and their contribution to our communities. So, and that's what we need them to understand, that financially, it is better to treat these patients and get them treatment, get them tested, to save everybody. And since it hits our community, people of color, more than anyone else, we're already in a disparity. So
Right.
when we lose more, then it's hard for us to recover. So that's why
Absolutely.
it expands beyond that.
Absolutely. Oh my gosh, my mind is going so many places. Just the conversation around diabetes. And I heard a lecturer once say, diabetes itself doesn't kill people. It's the complications of diabetes that kills
Hmm.
people. And so I thank you, Dr. Sneed. I'm going to ask you to take us on home. If is there a call to action you'd like to share? Any final thoughts? I so appreciate you, and y'all that are watching, please do not forget to subscribe, to share, to like, share this information. Has been fabulous. You have a woman who is not only, of course, board certified and all the things as we share, but she is so passionate about this. And she is right here in our own backyard. And we are really like screaming from the mountaintops. We want to share this information. So if you have a loved one, a neighbor, a friend that is dealing with this, maybe not, they're not yet to the discussion of amputations, but that they are poorly controlled. You watch them being poorly controlled. You hear that, you see what they're eating every day. Please share and get them the help that they need. But I'll let you, Dr. Sneed, take us on home.
Okay, two things. One, you mentioned, hey, I'm just OBGYN. I don't see this. I told you I have a patient now that when she was giving birth, she had some complications, unfortunately. So she was in a coma for some days. While she was there, everyone was treating everything else. No one bothered to look at her legs. So
Mm.
when she awoke, I think maybe like a week or two later, she only had one toe left on one foot. So I know you think it doesn't impact anyone who might be in OBGYN, but no matter what field of medicine you're in, you just make sure you're watching these patients, especially if they're hospitalized and they're not moving around. Make sure that they have pumps, their circulation is moving while they're in the bed, whether they need an air mattress or something. You need to watch the feet. We get wounds on the back of the heels and so forth, the cubitus ulcers. So all of those things affect everyone.
Mm-hmm.
Um, Number two, you mentioned about access. So whether you're in a big city like Atlanta or not, there's ways we get to you. So I've had people call from Texas, from Mississippi, from South Georgia. I'm not there. I don't know everyone there, but then we have a network of those who specialize in this. And I call this person and they call that person. They say, oh, well, I know this doctor here. Oh, there's one. And I had a doctor who I'd never met before who drove an hour in South Georgia to go see this patient who was critical, who was in the hospital saying, I don't want an amputation. And they were able to save them. So just
Mm.
because you have access to someone who's a specialist in this in your hospital, don't let that stop you from reaching out to someone until you get the answers you need. So, and
Wow.
then lastly, just make sure that you always have advocacy. You want to make sure whether it's you or someone you love or a neighbor, you need to make sure that they feel that they have someone backing them who wants to fight for their legs as much as they want to. Don't let them give
Mm-hmm.
up. It's a very depressing situation to even be faced with. And sometimes they give up and say, just cut it off. Don't let them give up because there's so much more to lose. It's harder to work on it, but it is worth it all the time. And when you see this patient get up a few weeks later and they're walking around and they're back at work and they're seeing their great grandchildren, it's all worth it. So don't ever give up unless there's something critical, unless it's life threatening.
Wow. Thank you again.
You're very welcome. Oh, thank you for having me.
Awesome.
The content shared on this podcast is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by our guest and host are their own and do not necessarily reflect the official positions of GSMA. At GSMA, we stand on over 130 years of medical excellence and advocacy, but we encourage you to always consult your physician or qualified health provider with any questions you may have regarding a medical condition. If you think you may have a medical emergency, call your doctor or 911 immediately. Until next time, stay informed, stay empowered, and stay well.